Hi, Noely. It's lovely to have you here today, and thanks very much for agreeing to talk to us about your volunteer to career story. I wonder if you can tell us a little bit to start with what brought you to volunteering.
Hi, Joe. Hi. Thank you for giving me this opportunity to talk about my experience within the trust. I have been volunteer before working as a staff. I was working as a volunteer. So I signed up to help out on the ward, and I've been supporting service users by selling them drinks, toiletries on the ward while I was doing my job as well. I had an opportunity to talk to them as well, catch up with them, find out how they are doing on the ward, and I really enjoy doing my role as a volunteer within the trust. And the reason why I decided to join the trust was I was researching about the trust. I've read positive feedback about the trust and review, which actually motivated me. And also, I also decided I should join the trust and also make change in people's life. And after doing that, then I built my confidence, wanted to do more, go extra mile. I mean, wanted to become a staff, being part of the trust, and doing more in terms of working with patients face to face as well. After a year, then I went to do my study in nursing mental health, and then I became.
You wanted to be a mental health nurse before you started volunteering, Noely?
No, actually, I didn't. I didn't. I wasn't even considering of that. Who at that time? It was only me helping out and making change in people's life. That's what I had in my face, in my mind when I joined the trust. And then again, when I was going there, most of the time supporting patient on the ward, every single ward when I used to go sometime with you as well. And talking with the patient, I realized that I wanted to do something positive to them and make a change in their life, because most of the time the way mental health is perceived is completely different. So people tend to have different view of mental health services, whereas mental health, I mean, can affect every single one of us, but in a different way. So therefore, I just wanted to be part of those staff member that was on that actually were on the ward, included yourself, that wanted to make change in their life as well. So talking to them actually made me realize there was a passion that I had, and then me having to enroll into a course in mental health nurses was gonna actually enabled me to make that change in patient life, and also decided I should enroll. After enrolling, I completed my courses, and then the pandemic started. And when the pandemic started, I was fast-tracked, helped again on the ward in a very unprecedented condition.
Yeah, really difficult time to start, to enter your nursing life, or maybe a really good experience to kind of learn under those real pressured situations.
Indeed.
It's really fantastic to hear that your volunteering experience kind of inspired you to go into nursing. And I wonder, what kind of skills do you think you were able to gain when you were volunteering that helped you in your nursing degree and then into your nursing job role that you're doing now?
What actually really I've learned in terms of, I mean, listening skill, because when we was supporting the patient on the ward, it was not only about making sure they're getting toiletry, making sure they're getting books, making sure they're getting snacks, making sure they're having fruit. No, it was also about building that rapport of trust, and then being able to talk to you. Stop 1 minute for a second, having a quick chat, maybe throughout the day, they did not perhaps had an opportunity to speak to someone and seeing someone was actually selling them something they really like, and also using the opportunity and be able to talk to them. So I developed effective communication skill. At the same time, I was able to sell them drinks, or encouraging them to get the books to read. I was also able to use my skill to talk to them, finding out how they were doing, if they needed help, what kind of book they were interested to read. I just wanted to learn a bit about them and just knowing the interest so that I can feed back to you, and then we can get more of the stuff that they needed, which I found it was really useful. And also effective communication skill was really, really important. And also that confidence of not being judgmental, that knowing that every single word, they're patient, they're just like me. So I wasn't seeing the condition first. At first, when I was supporting the service user, I was seeing the individual in front of me. I didn't put the condition first. It's an individual actually I'm serving who could have been me, or any of my relative, my friend, any of my colleague. So therefore, I was able to talk to them, build that rapport, that trust with them, and also learning about themselves, learning about what has led them to relapse as well, and then perhaps also having to liaise with other members of staff in terms of any concern they might have actually maybe highlighted to me, and then feedback to them. And then I did find it really, really useful. I mean, just being in contact as well with them, and it was a very good experience.
That non-judgmental approach and treating somebody as a person is really important to patients, isn't it? Because, as you say, they are individuals in their own right and not defined by their health conditions. And I think sometimes when they're in hospital, that's something that can help when staff are having to treat conditions and refer to that. Those conversations out of care teams are really important to people and definitely help in their recovery, I think. So yeah, that's fantastic to hear.
Yeah, and also, sorry to interrupt you, and also what I've noticed as well with mental health, when I was serving the service user, building a rapport with me of trust that actually even motivated me more. I thought to myself, we see the person, sometimes we tend to separate two things, that we actually looking at the condition first and then treating the person after. Whereas if we treat the person first and then look at the condition, then after, then they will get the proper support and care they needed. And also trying to also utilize the experience I've gained on the ward and be able to share that with my other relatives and friends, people out there in the community. This is not the perception that you do have in terms of mental health. I mean, mental health patients, they're not violent. Mental health patients, they're just an individual like you and I. So, yeah, something I really cherished that experience I actually gained while I was a volunteer. And also it was something that actually really that motivated me more. That this is the field I think I want to focus on. This is the field where I think my passion really lies on, and I want to make a difference within that field.
Yeah, I think that's evident, and all those approaches you bring and how you talk about looking at the person first and bringing that into the care you then give someone, so it's more patient-centered, it's really fantastic. And I think it's fantastic that you're a mental health nurse. I think you always kind of show those sorts of compassion and, like you say, communication skills and really listening to people, which I think makes you a fabulous nurse. Obviously, I'm a little bit biased, but it's fantastic to see that's an area that you've gone into. I wonder if you want to tell people a little bit about the nursing role you're doing now and what sort of things you get up to as a mental health nurse in the trust.
After completed my volunteer work, I decided to join the trust as a newly qualified nurse. Although I did my training within another trust, they wanted to retain me. but I decided that I wanted to make a difference in an organization that grounded me in order for me to become who I am. So therefore, I decided that I should return within the trust and work within the trust. So I decided when I applied for the job, I was being assigned to work on Pearl Ward, which is a SAM ward. So I was able to work as a newly qualified nurse. My role was to attend the MDT meeting and also liaising with the patient relative and other professionals involved in the care. And I was also able to coordinate the shift and also able to escort a patient on Section 17 leave, spend more time one-to-one with them, engage them in activities to enhance their recovery as well. And also I'm able to support the patient, attend to their need, be able to listen to them, see them from see them within the transition whereby they've been unwell and to the recovery was something I really, really love. I enjoyed really seeing them recovering because the patient sometimes used to come really, really acutely unwell. And then within that period, you build a trust rapport with them and the family, you involve them into the care, and then you see them, recovering. And then in the end, you see the patient there. Actually, they're able to even tell you, thank you, I really appreciate your help and support. And then that really, it really, really make me, at times I was a bit tearful, and I said to myself, wow, whatever, before joining the trust, it was always my dream that I wanted to do that. And now I'm seeing that from the patient themselves and the relative telling me how much difference my contribution has made to the family life. And then I've found it really rewarding, really. And at the moment,
heartwarming to see the impact where you've helped somebody on their recovery and know that they're really thankful for the support you've given them. So yeah. It's a really rewarding job.
Very indeed, very, very rewarding.
That's fantastic. Yes. Well, thank you very much, Noely, for speaking to us today about your volunteer to career journey. Congratulations on your most recent role as a community mental health nurse in the community teams now, which is fantastic. And we wish you all the best.